Hello people, in this video let us look at LASIK. LASIK actually stands for laser in situ keratomileusis. Okay, laser in situ keratomileusis. So what is it? Laser in situ keratomileusis, LASIK. So what is this? This is a surgery that uses laser. Kerato usually refers to cornea. So you're shaping the cornea with laser. What is this mileusis? What is the meaning of this? Shaping, carving of what? Of the cornea. Okay. So with laser. So in this what they are doing is especially for people who have myopia or hypermetropia, astigmatism, presbyopia, aphakia, pseudophakia, for all these things you can do this LASIK. Okay. So basically what is this? Shaping of cornea, right? Shaping of cornea using laser. Okay. So just see what they are doing here. The cornea, they have raised a flap. Okay. Tissue flap they have raised. Can you see? Usually they do this using femtosecond laser. Then they are sculpting this corneal stroma. Either they will make it flat or they will make it little more curved as required, and then they are closing the flap. So there are no sutures, nothing. So this is almost painless, they say, right? So what are they saying here? So in this technique, they are raising a flap of 130 to 160 micron thickness. Okay, how much thickness? 130 to 160. Can you say 130?
130.
Yeah, 130 to 160 micron thickness. They are raising the anterior corneal tissue with the help of what? Actually, femtosecond laser. Earlier, they were using it using microkeratome. This they don't do now. This is the keratome, microkeratome. See, they are raising the corneal flap. Okay. This, what we are showing you now, this one is actual keratome. This is not what they're talking about, right? They're talking about microkeratome. But anyways, now they don't use this microkeratome also. What do they use? Femtosecond laser, okay, for the flap. Then after they create this flap, using this excimer laser, they will shape the cornea. So look at this now. There are so many lasers, right? They use in ophthalmology. Look at this. There's excimer laser here and the femtosecond laser here. Which one are they using first? First of all, they're using the femtosecond laser. This is 1053 wavelength. Okay, we have arranged according to the wavelength increasing. So femtosecond laser here is 1053. So it will be very high wavelength, so low frequency it will be, right? It will be low frequency. So this they are using for photo disruption. Usually high wavelength they will use for disruption, etc. Then what they will do, they'll go and shape the cornea. Shaping the cornea, they will use excimer laser. This wavelength is 193. It is the least wavelength in this list, you can see. So this they will use for doing photo ablation. Okay. So can you say femtosecond?
Femtosecond.
Can you say excimer?
Excimer.
Yeah. So femtosecond is for what? For raising the flap. Excimer is to shape the cornea. Okay. So where and all will you use LASIK? You will use it for myopia, hypermetropia, astigmatism, presbyopia, aphakia, pseudophakia. Remember these three are what? Refractive errors. Myopia, hypermetropia, astigmatism. Presbyopia is more an accommodative error. Aphakia is where there is absence of the lens in the fossa wherever it should be there. And pseudophakia is artificial lens where an IOL is there. So for myopia, what is it? Myopia, they're saying that up to 8 diopters, minus 8 diopters, you can use LASIK. So they're using some ALK machine here. What is this machine? It's some automated lamellar keratoplasty eye surgery, but here it's not corneal transplant exactly, right? They're just shaping the cornea. See here, you can see the layers of the cornea. You have the epithelium, stroma, and endothelium. So they will raise a flap here and they will raise a flap here. They will shape the stroma and they will close the flap anyways. So up to minus 8 diopter for myopia, they can do this. Okay. So this is myopia where they can see near things only. They cannot see far things because the image is forming where? In front of the retina, right? Normally you can correct it using concave lens, right? You can correct it using concave lens. You can see here. But otherwise people don't want to wear this contact lens or spectacles, then they will do this LASIK. The same thing when you do for hypermetropia where the image is forming where? Behind the retina. For up to 4 diopters, you can do hyperopic LASIK. The same LASIK, they are calling it as hyperopic LASIK when you are doing for hypermetropia. Image is forming where in this case? Image is forming behind the retina here, right? Image is forming here. Right, image is forming behind the retina where in hypermetropia. So they will do hyperopic LASIK. Okay, then coming to astigmatism, people who have this astigmatism, what will they have? They will have multiple foci, you can see here, right? So basically for this also they can do LASIK Let us see if this looks complicated to me actually. LASIK procedure can also be adopted to correct astigmatism up to 5 diopter. LASIK procedure can also be adopted to correct post-keratoplasty astigmatism. So after they do a keratoplasty, that's a corneal transplant, if there is astigmatism, even that they can correct using this LASIK. What are we looking at in this video, people? LASIK. Can you say LASIK?
LASIK.
LASIK. You know what LASIK is? No? Okay. So now let us look at presbyopia. Presbyopia also has so many LASIKs basically. You can correct this with help of monovision LASIK. One eye is corrected for the distance and other is made slightly nearsighted. Why does this look so bad to me? One eye they will do for corrected for distance. The other made slightly nearsighted. I don't like this. Okay, then for each eye different thing. One for distant, one for near. Okay, then presbyopic bifocal LASIK, or it is also called as LASIK PARM. That is presbyopia Avalos-Rozakis method. Can you say this? Avalos Rozakis. Yeah, that is PARM. Presbyopia Avalos-Rozakis method technique, where they are shaping the cornea to have two concentric vision zones to help the presbyopic focus near and distant object. Oh, this is bifocal. Okay. So you can focus near and distant. But I really, people who wear bifocal spectacles itself cannot tolerate bifocals. Because I have seen my own mother see, this will be the spectacles and here there will be a place for near vision and this will be for distant vision. It is very difficult. You get confused. I would rather wear a distant separate and near separate. Anyways, that's up to you. Bifocal spectacle itself cannot be tolerated. I don't know how these people will tolerate bifocal LASIK. That will be, cornea itself will be shaped to have two concentric zones. Okay. Okay guys, let us know how you feel about it. Let's move on now. So you can use it for presbyopia. Then what else can you use it? Aphakia also, guys, they don't have the lens, right? Then if they don't have this lens itself is not there, then they can do some cornea shaping so that it will bend more light so that the image will form on the retina. So they'll have to make this very curved, right? What do you think? So hyperopic LASIK only they are doing. Yeah. So they're going to make it more curved. If you cannot put secondary IOL. Pseudophakia to correct refractive error again. Now you gave that person an artificial lens, pseudophakia is there, but still there is some refractive error. Then obviously you can do some cornea shaping LASIK. Okay. Then, so how will you select a patient for LASIK? The patient should be about 20 years of age. Stable refraction should be there for at least for 12 months. So just for 1 year they should have stable refractive power. Okay, their refractive refraction should not keep changing. Okay, they should have a stable power, guys. Okay, focus. Then we are moving on to what now? The patient should be motivated. What are the contraindications? There should be no corneal pathology. Obviously, you are working on what? You are working on the cornea. This is your cornea under the microscope. So this cornea should not have any pathology. It should be as beautiful as this, right? And it should have, there should be no ectasia or any other corneal pathology. What is ectasia? Can you say dilation?
Dilation.
Yeah, that is called dilation or distension of tubular structure is the ectasia. Dilation, you can remember. Okay. There should be no corneal pathology. And corneal thickness less than 450 micrometer is an absolute contraindication for LASIK. So it should not be less than how much? 450 micrometer.
450 micrometer.
Yeah, the corneal thickness 450 micrometer, guys. It should not be less than that. And these people should not have any diabetes, glaucoma. They should not be pregnant or lactating. Keratoconus should not be there, right? Imagine if the keratoconus is like this, and how will it be so thin and so difficult to work with? So there should not be any keratoconus. Remember, the thickness should be at least 450 micrometer. Otherwise, what will happen? How will you raise the flap, shape it and all? You need some place to shape and all, right? Okay. Then contraindications you saw. Now let us look at advances in LASIK. See, they have customized LASIK. What is this customized LASIK or C-LASIK? What they are doing here? Customized. They are customizing it. Is it to whom? So you can get vision beyond 6.6. What the hell is this? Vision beyond 6.6. You'll be able to see even better than normal. Why? Corneal topography wavefront technology. They're using some wavefront technology, corneal topography, some special technologies they are using. In this technique, in addition to spherical and cylindrical correction, you can correct aberrations present in the eye. What is aberrations? Aberrations present in the eye. Means something abnormal, they are saying, just as abnormal. Anything abnormal also you can fix, and you can get vision beyond 6.6. Wow. Then you have femtosecond laser known as all LASIK laser. This is the one we are talking about. This is very normal. Femtosecond laser only. Instead of using that microkeratome, they are using femtosecond laser. This is nothing. Okay. This is all laser. That means you're using all laser. To raise flap also, you're using laser. Guys, focus here. What are we talking about? Femtosecond laser. Femto LASIK. Instead of microkeratome, you're using femtosecond, femto laser. As simple as that. Right? So you'll use, for lasing flap also laser. For shaping also, you'll use excimer laser. So it'll be all LASIK laser. That's it. Sorry, all laser LASIK. Yeah, all laser LASIK. No blade LASIK. Everything is same. Okay. Then you have custom femto LASIK. CF is LASIK. They mixed both of this. Custom LASIK and femto. So it became CF LASIK. Here they will use same thing. Corneal topography, wavefront guided LASIK. In which corneal flap you're making with femtosecond laser. So you're using all the three technologies. You're using laser. For the flap, you're using corneal topography, wavefront guided LASIK, everything. EPI LASIK. E-LASIK. What is E-LASIK? E-LASIK. Instead of corneal stromal flap, only the epithelial sheet is separated mechanically with the use of customized device like epi-edge epikeratome. So they are using some epi-edge epikeratome. Epi, everything refers to epithelium here. They are only working on the epithelium. The epithelial sheet is separated. Instead of raising a corneal stromal flap, so till now they were raising a stromal flap. Instead of a stromal flap, they are raising an epithelial sheet. Okay. So they are working even more superficially, right? So they're just going to raise an epithelial sheet. Being an advanced surface ablation procedure, they are working as much as possible on the surface, so it is devoid of complications. So this is better kind of thing they are saying. Okay. Well, so we are done with all the advances in LASIK. Can you say the advances in LASIK? All of them, guys. Say C LASIK. C LASIK.
C LASIK.
Say F LASIK. Femto.
F LASIK. Femto.
Then C F LASIK.
C F LASIK.
Then say E LASIK.
E LASIK.
Yeah, so C, F, E, all these. Okay, that's what you have here. What are the advances if they ask somebody? No, you just say, hey, that only C, F, E. That's it. Okay. Then advantages of LASIK, guys. Let us finally cover in this video. Just two more things to go. Advances and disadvantages will finish off. Okay. Advantages of LASIK. No post-operative pain or very minimal pain only. They are saying. Then you will recover early. Recovery of vision is early compared to PRK. So now you need to know what PRK is, right? So in myopia surgical treatment, you have seen that you have some options of cornea based procedures like radial keratotomy, this one, where you're making some slits and flattening the cornea kind of thing, right? And then you have the laser ablation corneal procedures. You have the photorefractive keratotomy, and then you have the laser. What is this photorefractive keratotomy? In this photorefractive keratotomy, you can see there's no flap. They're just removing off the outer layer. That's really bad, right? And then they're shaping it. There's no flap at all. So not nice, right? So compared to PRK, this is better. There is no risk of perforation. There's no risk of globe rupture. There's no residual haze, right? It should be no residual haze. No residual haze. No risk of perforation. No risk of rupture of globe due to trauma. Right? Because here in PRK, what you saw is epithelial kind of is removed, right? So there could be subepithelial scarring. So there could be haze. But here you don't have that issue. You're just raising a flap. LASIK is effective in correcting myopia up to 8 diopter. Then you can say hypermetropia up to 4. Then you can say astigmatism up to 5 diopter something. Then presbyopia also you can fix. Then you can fix what and all? Aphakia, pseudophakia. For all this you can do LASIK. So these are the advantages. Now let's go to the disadvantages finally. Disadvantages of LASIK. It is more expensive. Yes. Okay guys, LASIK is more expensive. You understood. Then it requires greater surgical skill. So that is a disadvantage they are saying. And there is a risk of flap related complications. What are flap related complications? The flap itself is creating problem now. Intraoperative flat amputation. Flap itself came off. Wrinkling of the flap. Okay, then post-operative flap dislocation, subluxation. After the surgery, this flap is moving out. Oh. Okay, then epithelialization of flat bed interface, irregular astigmatism. These people can go into astigmatism, right? Then other possible complications include infection. Obviously, you will write this infection. Then diffuse lamellar keratitis. So you landed up with inflammation of your cornea. Dry eye. You land up with dry eye. Corneal ectasia. We told you, right? That's some dilation or distension. Glare regression. So all this can happen with LASIK. Can you tell the disadvantages of LASIK? Can you say a dry eye?
A dry eye.
Dry eye will be there. Then infection. Say infection.
Infection.
Can you say a flap related complication?
A
Flap related
complication.
Yeah, I think everything else you'll write. Keratitis, etc. Okay. So let's take a recap, guys. What we have seen in this video. We saw LASIK. LASIK means laser in situ keratomileusis. Basically, this is a technique where they are shaping the corneal stroma so that the person can see better, right? So what do they use here? Femtosecond laser to raise a flap, and then after raising the flap, they'll use an excimer laser to shape the corneal stroma, and then they'll close this flap back. Okay, so this is laser. LASIK, laser in situ keratomileusis. Okay, so the flap they will raise how much? 130 to 160 micron thickness. Okay, then the lasers that they use in ophthalmology. So the lasers that they use in ophthalmology are, first of all, what do they use? Femtosecond laser, you can see here for photo disruption, that is to raise the flap. Then here you have excimer laser, which has very less wavelength. This you are using for photo ablation, that is to shape the cornea. So myopia up to -8 diopter you can fix. They will use the automated ALK machine, okay, and they'll use the excimer laser, obviously. Then what else? They can use it for fixing hypermetropia, that is called as hyperopic LASIK. Otherwise, LASIK will refer to the myopic one. Hyperopic LASIK up to 4 diopter. Then to fix astigmatism also you can use. Then to fix presbyopia, you have monovision LASIK and LASIK PARM. That is LASIK presbyopia Avalos-Rosakis method. I think you're going to forget this. Avalos-Rosakis method. Presbyopia Avalos-Rosakis method. This is bifocal LASIK, 2 concentric vision zones in the cornea. I don't like this. Then coming to aphakia, you can try to correct it. Same thing, hyperopic LASIK. Pseudophakia also you can do. You can fix some refractive error. LASIK, how will you select the patient? Patient should be about 20 years of age. Stable refraction should be there at least for a year. The patient should be motivated. Contraindications, there should be no corneal pathology. Ectasia, the corneal thickness is less than 450 micrometer is an absolute contraindication. Then if there's diabetes, glaucoma, pregnancy, lactation, keratoconus, don't do this surgery. Advances LASIK, you have custom LASIK, femto LASIK, custom femto LASIK, and is epi LASIK. That is only epithelial sheet they will raise instead of corneal stromal flap. What is C? That is customized LASIK. Here they will use corneal topography and wavefront technology, and here they will give vision that is beyond 6/6. Wow, you will become like a Superman. You can see more than normal people. That will be more like a cat or something. What you can see a lot. Advantages of LASIK. It is there's not much pain. The recovery is early compared to the photorefractive keratectomy. What is PRK? Don't forget. Photorefractive keratectomy. In which what they do, they raise off flap like this, and they'll not raise flap. They'll remove the outer part and then they'll shape it. So there's no flaps. That's keratectomy kind of thing. That's not good. So then what else? There can be perforation of, there's no risk of perforation of any perforation or rupture of globe. There is no risk of residual haze because there is no subepithelial scarring that occurs, that kind of scarring occurs where in PRK. And LASIK you can use to correct myopia of -8 diopter, hypermetropia, +8 astigmatism up to 5 diopter, presbyopia, aphakia, pseudophakia. For all this you can use. Disadvantages, it is expensive. Greater surgical skill you need. Flap related complications, flap amputation, wrinkling of the flap, flap dislocation, subluxation, epithelialization of the flat bed interface. Irregular astigmatism these people can develop. What type of astigmatism? Irregular astigmatism these people can develop. Then they can go into infection, dry eye, keratitis, regression, glare. They can have glare. What is glare? Photophobia? or what? Okay. So all this is LASIK. We are done with LASIK. Bye bye.